chakras, the pranas, and the nadis. Again, I have put this in the end because scientifically we do not have subtle instruments to yet measure all these things. Some say there are, some say there aren't. Next one. This is our aura photography. Here, this is an aura of a disease before healing of a person who is sick, and after healing, the aura has become better. Next one. This is my last slide. So, first thing, just go pressing. No. When chronic diseases are what are common, and next one. First, what happens is a psychological change in everybody. First thing that occurs is a psychological change that in turn leads to a mental change in the nervous system, either sympathetic or parasympathetic, that in turn leads to either immunological change or it will lead to a humoral change. When you say immunology, their system to combat diseases becomes worse. Humoral change, the hormones will become changed. And if these are affected, it leads to chronic diseases. Okay? I think this is my last slide. Namaste. Thank you. Thank you all for giving me an opportunity. Sorry, I did not face the mic. Thank you.
Thank you very much, Dr. Jayashree. That was a very well presented, evidence-based presentation. I invite Shri Pati Sridhar to kindly come and felicitate Dr. Jayashree. Dr. Rajeev is currently an associate professor at the Department of Radiotherapy at MS Ramaiah Medical College, Bangalore, Institute of Oncology, HCG Specialty Center, Bangalore Baptist Hospital, to name a few. He is the founding person of Rural Cancer Clinic, founder trustee of Cancer Care Platform, and the president of Cancer Care Platform Trust. Among several achievements, he has researched and published papers relating to cancer. He is a spokesperson at Aviratha and is a medical advisor at Suraksha. Dr. Rajeev, please.
ಇಷ್ಟೆಲ್ಲ ಮಿಂಚುಗಳ ಮಧ್ಯೆ ಈ ಒಂದು ಮಿಂಚುಳ ಸ್ವಲ್ಪ ಪ್ರಕಾಶಮಾನವಾಗಿ ಕಾಣದೇ ಇರಬಹುದು, ಕ್ಷಮೆ ಇರಲಿ ದಯವಿಟ್ಟು. ಡಾಕ್ಟರ್ಸ್ ಟಾಕ್ಸ್ ಆರ್ ಆಲ್ವೇಸ್ ಬೋರಿಂಗ್, ಸೊ ಕೈಂಡ್ಲಿ ಎಕ್ಸ್ಕ್ಯೂಸ್ ಮೀ ಆನ್. ಟುಡೇ ವಿಲ್ ಬಿ ಟಾಕಿಂಗ್. Thank you, sir. Hopefully it happens to everyone. Today I will be talking on energy preparation for the patients who are suffering from cancer. Blessed, not blessed, I don't know. After completion of my MBBS, I somehow was offered a seat for oncology. I did not know whether should I accept it or shouldn't I. The word cancer itself is very terrifying. You know, eventually all your patients will die in your own arm. That's the real truth. Today, tomorrow. So any patients who come to me, I always say, I'm your family member. And it's a fact too, and it's truthful, because they complete their life journey with us. So I'm part and parcel of almost more than 7,000, 8,000 families whom I have treated all these days. I started my journey in Ramaiah Hospital. Next slide, please. This is my cancer hospital. It's there located in Mysore. Next slide. This is my Dharmasthala, and I am a priest there. The next slide. So introduce to how we got along to a thought of healing the patients or preparing them with some energy before going on for the cancer treatment. We had a small discussion. Dr. Saraswati Hegde, Dr. Saraswati is here. She was in the department of Rani Killing in Ramaya. Jayashree madam is there. She was the person who brought both of us together. She was my teacher in Ramaya. So with having imbibed this knowledge of energy preparation, and the other thing which made me to think of energy preparation was, I am myself a healer from 1997. So all these three came together and we thought that yes, we should be doing something beyond than our regular treatment. When we thought this, and when I told that in my department that I will be doing this, I was laughed upon. What are you talking all these days? There is something beyond all these things and you yet believe in all this. Okay, madam, there is nothing harm which I am doing. I am not giving anything extra medications. I am not bringing something out of the books. They will be sitting for a small meditation or they will be just sitting for 10-15 minutes in front of Saraswati madam and she will be doing a healing. And then the patient comes for the regular treatment. There is nothing that I am giving the patients as a drug, nothing I am removing them out of a drug. So again, the word of randomization came in. Next slide, please. The basis of when we started thinking of I should be doing this was the lady which again made me to think of, yes, we can do it. She's an American cancer patient healer. Dr. Sarai Enriquez, I think Dr. Foss would also have known about her. Every time when we think of healing or energy preparation, she felt that there is a lack of evidence because we don't document it well. That is, so we think we should start thinking of documenting what we do. If we do that, then only the present situation of the authenticity of it comes. Why the Western world always thought that, why they gave the Indian history as mythology? Because we don't have the documentation. We never should be thinking of calling it as a mythology. Mythology is study of lies. We should be calling it as Indian history. It doesn't mean that I have not seen a world, it doesn't exist. Have you seen Arctica, Antarctica? No, most of us wouldn't have. All of us wouldn't have. Won't we believe that it is there? Yes, it is there. Shouldn't we believe that Ramakrishna existed? Yes, we should believe it. Because we don't have the documentation which the Western world asked for, doesn't mean that Indian history never existed. So, in the same sense, these kind of healings, even when we were young, Badrushti Tagona, they used to take the fistful of salt or porke kaddi or the broomsticks. They used, again, the fire. They used to cleanse the negative energy which we had. The same thing started on with something called as a healing, the pranic healing, the reikis and all these things. Pranic healing even today uses the salt water for healing. So the basis remained from our ancestors, which we need to adopt it very scientifically, methodologically and move it forward. The next slide, please. The other gentleman, Dr. Sundar Rajan, he is there in Rishikesh even today. He is the person who does the cancer pain management, not just cancer pain, any pain management through healing. Again, he has documented a lot of things and his main way of doing things was through the thymus gland, which stimulate the T cells in the thymus gland, again which is needed for fighting the creating the human resistance or fighting the negative things which are there inside the human body and document. He has also documented. Even today, he has the healing center in Rishikesh. It is called as Ganga Prem Healing Hospice. Many patients with the stroke, the cancer patients, terminal cancer patients, they've all been there. Especially when he documented the use of morphine. Morphine is one drug, one tablet, which doesn't have a ceiling. For an example, a paracetamol, a crocin tablet what we take for fever, we can't give it more than 50 milligrams per kg per day. But this morphine drug, it doesn't have any limit. I start with 10 mg every 4th hourly. Patient can go up to 1 gram, 2 grams till he feels that yes, my pain is reduced. So this is the drug called as morphine. When you take the WHO ladder of pain management, morphine comes at the last. If the person can't be controlled with morphine, there is no other drug available as of today to control the pain in the cancer patients. That kind of a terrible pain the terminally ill cancer patients face. So in his hospice, he started healing these kind of patients, and he found that there is a profound benefit. Many patients withdrew from morphine. Many patients, the doses were reduced. Many patients, the schedule of giving the drugs came down. So these were the two gentlemen which imbibed us or inspired us to carry on something a little bit different. Next slide, please. So you all know what pranic healing is. Yesterday, Madam also might have briefed. I will not go more on that. The prana shakti, giving the prana shakti externally also is the healing through the prana. The next slide, the principle, law of self-recovery, where you can sit down yourself meditating and you can recover yourself through the methodology which you have done. It might be through pranayama or yoga or meditations, whatever way. The second one is the law of life energy, which is rooted through a different way, where the healer comes into a play here. Next slide, please. There was one gentleman, Mr. Jones. He demonstrated it. The cancer cells were grown on a petri dish, and they were given the gamma irradiation. You can see those A, B, C, D, E. The A, the control group, controls dishes for that matter, where there is the percentage of cells which were not offered anything. The dish remain as it is. So 99.6% of the cells remained as it is at the given point of time. The second group of dishes were irradiated with gamma zone monitor, where 50% of the cells died. The third group, the pranic healing after the radiation, where 76.5% of the cells were alive. The third group, pranic healing before radiation, which means that it gave a more effect, which more benefit than doing it after radiation, where 89.2% of the cells remained alive. The third one, before and after, you can see the control group of 99.6, the later one with 92.3. So this is the effect of energy which can be brought in, given to the patients. The next slide, please. So the cancer, as I told you, it's uncontrolled division of cells. The four main ways of treatment is surgery, chemotherapy, radiation therapy, pain and palliative care. Pain and palliative care is also a form of treatment. Don't think that only the surgery, chemotherapy and the radiation therapy are the treatment. Pain and palliative care, or the best supportive care, is also a treatment in cancer. So we had a discussion. We took patients who had a common criteria, where the chemotherapy and radiotherapy concurrently were given. Concurrent means both given together with radiation. So both given simultaneously for any patient. So the examples where we practice concurrent chemotherapy and radiation therapy is the cervical cancer, the esophageal cancers, the rectal and the anal cancers, and the cervical cancer. So we took the cervix cancer, which is a profound disease found in India even today, breast cancer and the cervix cancer. Cervix cancer is seen in women, where we give both the chemotherapy and radiation therapy together. Next slide. So again, the team came together, Jayanti madam, Saraswati madam, and myself. Next slide, please. We randomized 38 patients, 19 in each arm. We selected, the accrual happened to about 7-8 months. We selected the patients with no comorbid conditions. If we had comorbid conditions, we would not be specifically arriving at a conclusion. So we ensured that the patients did not have any comorbid conditions. The age criteria was fixed between 40 to 60 with no comorbid conditions. The next slide. So these were the stages of the disease. You can see the stage 2 and stage 3 disease has more number of people. That is what is seen in Indian pattern also. The next slide. So arm 1 took only the radiation and chemotherapy. The arm 2, along with radiation and chemotherapy, the patients used to go for pranic healing about half an hour prior to the treatment every day. And even the drug, what we used to give as the chemotherapy, this is cisplatin drug, the vials also used to go for energizing. So after the energizing, the patient used to get infused with the drug also. Cisplatin is given once a week. So the healing of the drug used to happen once a week. Patients used to go for healing every day before radiation therapy. So this is the randomization chart. The next slide, please. So all the patients received a dose of 45 gray. The dose of radiation is not told in milligrams or grams. It is called as gray for the knowledge. Again, the dose of the cisplatin was 40 milligrams per meter square of the body surface area. That is how we calculated the dose in oncology. Oncology is never body kg weight. It is always meter square of the body surface area. So the chemotherapy drug was healed 30 minutes prior to be given, and the patients used to get healed 30 minutes prior to receiving of radiation therapy. Next slide. The three main criteria in any of these kind of a concurrent chemo radiation is the nausea, the vomiting, and the loose stools. Why we did not take head and neck patients? They don't get treated, their intestines, the intestines will not be there in the field of radiation. So the arriving the conclusion on the loose stools will get diluted. So that's why we took only the cervical cancer patients where all these three side effects are seen commonly: nausea, vomiting, and the loose stools. So all the scores were documented based on the WHO grading of the side effects. The acute side effects were only measured, not the delayed side effects. Next, the results. So we can see the results. The first one is the nausea. We can see the intervention arm, the grade 0, the patient who did not have any nausea were more as compared to the grade 2 in the control arm. Grade 2 is about 3 to 4 episodes of vomiting in every patient. The next slide. The vomiting, again, the patient who did not have vomiting is 0 in the intervention arm. Most of them are 0 to 1, whereas in the control arm, the patients had vomiting. The next slide. Now coming to the loose stools. Why these loose stools happened? Probably we did not concentrate much on the Muladhara chakra, I believe. We probably, and the patients who used to go for healing, we used to do all of them together. We used to do something called as a mass healing. Not individually we could do it, because it would take a lot of time. There were other patients who used to come for healing, and also probably we should have concentrated patient as an individual when he did it. We did most of them, we did it as a group healing, or 3 or 4 people sitting together, and the healing happened in that way. We neglected this fact. It might be a wrong thing on myself itself, because I did not bring it to the notice. Thus, this has to be concentrated too. This was the documentation which was done, which was seen. Probably it needs gap closure, or the future science or the future trials which go on should think of concentrating on towards the doing the healing individually also. So there was not much of a change in the pattern in loose stools which we could see. The next slide. The results. It will be a little bit difficult to understand this. Doctor language with mathematics is much more boring. So the risk of all this means is the 100% of the patients in the control group will have nausea, whatever grade it might be. Whereas in the intervention group with healing, it's only 20%. The vomiting, 100% of the patients will have one or the other form of vomiting, whereas it's half in the intervention arm. Whereas the loose stools, it's almost similar. It's about 60% to 70% in each group which will have loose stools in either of the group. So the number of patients which needs to be treated to control one vomiting is 1.25 in either arms. This will help us to arrive at what should be the sample size in the next trial. This is which we can consider as a pilot. So based on these things, we can arrive at what should be the sample size when we do a complete randomization, fully controlled study. So to control the vomiting in a single patient, in one patient, we need to have 2.5 patients to be randomized. The same with the loose stools, we need 5 patients. So if we consider all these things, and this opens the scope for the next randomized trial. The next slide. Nausea, vomiting, and loose stools in the intervention arm were comparatively less. Median break in the treatment, that is also important, very important factor. the cancer treatment can't go with bits and pieces. It has to happen in a very systematic, regularized way. The cancer treatment for cervix cancer, including radiation, chemotherapy, and something called as a brachytherapy, should be over in 2 months, 60 days. We need 45 to 50 days for external beam radiotherapy itself, and we'll have only 10 days for the brachytherapy session to come up. If we give a break of 7 days, the chances of the patient coming up with the disease in the future, 3, 5 years, 10 years, will be a little bit higher as compared to those patients who do not have any break in their treatment. So the break in treatment is also an important factor. This is the additional point which we noticed there. The median break in the treatment was only 7 days, and the average stay in the hospital for the entire treatment was increased by 8 days in the patients who were in the control arm as compared to 3 days in the patients with the trial arm. Trial arm, again I told you, because we neglected the fact of loose stools. This is what we had seen. Next slide please. Again, pranic healing, we have got nothing to lose. It might be any form of healing for that matter. It is all to give the wide usage, because the documentation needs to go for next level. Use of Keralian photography also will help us. There is more need of scientific inputs, scientific methodology that needs to develop, documentation which needs to be developed to bring in all these into place and demonstrating this place and make it as a regular thing, not just for cancer, even for many other chronic diseases to come up. The challenges are huge. We need to gear up for all those things. Mix the many ways of treatment for a better world, better healing of the patients, and for the betterment of the mankind. Next slide, please. As is always said, there is very little to lose and very much to gain. And I thank you one and all. And many times when I had gone to Dharmasthala, I've always tried an opportunity to meet Virendra Hegdeji, to listen to his words. But today, he himself has provided me an opportunity so that he listens to me. That's the greatness which I have achieved. Thank you very much, sir. I'm blessed. Sir, in Vijayanagar, Mysore, sir. Vijayanagar. Very close to Bharati Vidyavana, on Onsor Road. Yes, sir. Please, sir. Welcome anytime. Yes, sir, please.
Hello.
Yes, sir.
Whether cancer is curable or not. Next question is,
sir.
we get lots of WhatsApp messages that there is some doctor in Pune or whatever it is, who cures completely cancer. What is your comment on these two? Please.
Sir,